Calcaneus fractures. Published by WordPress.com. Epidemiology. One of the most frequently fractured tarsal bones. Commonly results from high-energy trauma, such as falls from height, FFH, or motor vehicle accidents. Anatomy. Superior articular surface. Comprises 3 facets articulating with the talus. Posterior facet. Largest, major weight-bearing surface. Middle facet. Located anteromedial on sustentaculum tali. Anterior facet. Confluent with the middle facet. Interosseous sulcus, calcaneal groove, lies between middle and posterior facets, forming the sinus tarsi with the talar sulcus. Attachments and structures. Achilles tendon attaches to the posterior tuberosity. Sustentaculum tali supports the talar neck. Articulates with the cuboid bone anteriorly. Mechanism of injury. Axial loading. High energy impact such as falls to intra-articular fractures. Twisting forces. Leads to extra-articular fractures. Avulsion injuries. Tuberosity fractures caused by Achilles tendon traction. Clinical presentation. Ecchymosis, blisters, and medial open wounds. Compartment syndrome, 10% cases, may cause clawing of lesser toes. Associated injuries. Lumbar spine fractures. Acetabular fractures. Tibial plateau fractures. Bilateral calcaneus fractures. Imaging. 1. X-ray. Lateral view. Buller's angle, normal. 20 degrees to 40 degrees, decreased in posterior facet collapse. Gissane angle, normal. 105 degrees to 135 degrees, increased in posterior facet collapse. AP view. Fracture extension into calcaneocuboid joint. Harris axial view. Subtalar joint surface. Brodian views. Intraoperative assessment of posterior facet reduction. 2. CT scan. Preferred for classification and surgical planning. Classification. Extra-articular fractures. 1. Anterior process fractures. Due to strong plantar flexion and inversion causing ligament avulsion. 2. Tuberosity fractures. Avulsion by the Achilles tendon. 3. Sustentaculum fractures. Heel loading with severe inversion. And 4. Medial process fractures. Vertical shear fractures from valgus loading. Intra-articular fractures. 1. Essex-Lopresti classification. Primary fracture line, splits the posterior facet into 2 fragments. Anteromedial, stable, attached to talus. Posterolateral, commonly displaced. Secondary fracture line, tongue-type fracture. Line exits posteriorly through the tuberosity. Joint depression fracture. Line exits beneath the posterior facet. 2. Sanders classification, based on CT. Type 1. Non-displaced fractures. Type 2. 2-part fractures of the posterior facet, subtypes IIA, IIB, IIC. Type 3. 3-part fractures with central depression, subtypes IIAB, IIBC. Type 4. 4-part comminuted fractures. Management. Conservative treatment. Indications. Extra-articular fractures with minimal displacement, less than 2 mm. Non-displaced intra-articular fractures, Sanders type 1. High-risk surgical patients, e.g., medical comorbidities, blistering, severe edema. Methods. Bulky Jones dressing. Non-weight-bearing cast for 10 to 12 weeks. Operative treatment. 1. Closed reduction and percutaneous pinning, CRPP. Indications. Tongue-type fractures. Extra-articular fractures with greater than 1 cm displacement. 2. Open reduction and internal fixation, ORIF. Indications. Displaced intra-articular fractures, Sanders 2 and 3. Anterior process fractures with greater than 25% calcaneocuboid articular involvement. Displaced sustentaculum tali fractures. Timing. Surgery delayed until swelling subsides, 10 to 14 days. Approaches. Extensolateral, L-shaped, incision. Mini-open lateral incision. Medial approach for sustentacular fractures. N3. Subtalar fusion. Indications. Salvage procedure for Sanders type 4 fractures. Post-traumatic arthritis or failed ORIF. Complications. 1. Early complications. Wound dehiscence. Post-traumatic compartment syndrome. Perineal tendinitis. 2. Late complications. Post-traumatic subtalar arthritis. Malunion. Loss of calcaneal height. Heel widening. Lateral impingement. And 3. Treatment for malunion. Lateral wall resection. Subtalar fusion for associated arthritis. Varus or valgus osteotomies is required.